Here's a detailed guide on the hepatitis A vaccine. 1. Generic name, drug class, drug forms, brand name. Generic name, hepatitis A vaccine, inactivated. Drug class, pharmacologic class, inactivated viral vaccine. Therapeutic class, vaccine, immunologic agent. Drug forms, suspension for intramuscular injection, available in single-dose vials, prefilled syringes, combination vaccine, e.g. hepatitis A plus B. Brand names, Havrix, GlaxoSmithKline, Vacta, Merck & Co., Twinrix, GSK, combination of hepatitis A and B for adults. Hepatitis A vaccine is a biological preparation that contains inactivated hepatitis A virus. It stimulates the body's immune system to develop antibodies against the hepatitis A virus, thereby preventing infection. It is not a live vaccine, making it safe for use in many immunocompromised individuals. 3. Mechanism of action. The vaccine contains killed, inactivated HAV particles. Once injected, the antigen-presenting cells, APCs, process the viral proteins. These proteins are presented to T helper cells, stimulating B cells to produce HAV-specific IgG antibodies. These antibodies remain in the bloodstream, ready to neutralize the virus upon exposure. Memory cells are also formed, ensuring long-term immunity. NASH4 indications. Routine use. All children aged 12 to 23 months. Catch-up vaccination for unvaccinated children and adolescents aged 2 to 18 years. Adults at risk. Travelers. To countries with high or intermediate HIV prevalence. People with chronic liver disease, e.g. hepatitis B/C, cirrhosis. Men who have sex with men. People who use injection or non-injection drugs. Individuals experiencing homelessness. Food handlers in outbreak-prone settings. People with occupational exposure, lab workers, sewage workers, close contacts of infected individuals, individuals receiving clotting factor concentrates. 5. Contraindications. Hypersensitivity to previous dose of hepatitis A vaccine, vaccine components, e.g. aluminum hydroxide, neomycin in some brands, severe allergic reaction, e.g. anaphylaxis. Moderate to severe acute illness, with or without fever, vaccination should be deferred. 6. Before taking this medicine, precautions. Discuss with your healthcare provider if you are pregnant or planning to become pregnant. Hepatitis A vaccine is not contraindicated in pregnancy, but caution is advised. Are breastfeeding. Have weakened immunity, e.g. HIV/AIDS, chemotherapy. Have a history of allergic reactions to vaccines. Have a bleeding disorder, may need special technique for injection, are currently ill with fever or infection. Other precautions. Check vaccination records before administration. Delay vaccination if recently received immunoglobulin therapy or blood products. #7. How to use. Administered intramuscularly, IM, typically in the deltoid muscle of the upper arm or anterolateral thigh in young children. The vaccine is given by a healthcare provider, not self-administered. Shake the vial syringe well before administration. Can be given alone or with other routine vaccines using separate injection sites. 8. Dosing information. Adults, 19 years, 1 milliliter IM 2 doses, initial and at 6 to 12 months. Children, 12 months to 18 years, 0.5 milliliter IM 2 doses, initial and at 6 to 12. Vacta. Adults, 1 milliliter M, IM 2 doses, 0 and 6 to 18 months. Children, 0.5 milliliter IM 2 doses, 0 and 6 to 18 months. Twinrix, Hep A plus Hep B, adults only. Standard, 1 milliliter IM at 0, 1 and 6 months. Accelerated, 4 doses on days 0, 7, 21 to 30, and a booster at 12 months. Missed dose, overdose. Missed dose. The vaccine series does not need to be restarted, even if a dose is delayed. Receive the missed dose as soon as possible. Overdose. Overdose is rare and usually not harmful as it's administered by healthcare providers. If multiple doses are given accidentally, monitor for side effects, but no specific antidote is needed. 10. When to stop or avoid taking. Avoid or delay the vaccine if you experience anaphylaxis or severe allergic reactions to a previous dose. You are moderately or severely ill, with or without fever, at the time of scheduled vaccination. You have received immune globulin recently. It may reduce vaccine efficacy if given close together. 11. Side effects in detail. Common side effects and injection site reactions, pain, redness, swelling, systemic symptoms, fever, headache, fatigue, loss of appetite, nausea, or vomiting. Less common 110%, muscle aches, myalgia, dizziness, irritability in children. Rare 1%, allergic reactions, rash, abdominal pain, arthralgia, joint pain. Very rare serious reactions, anaphylaxis, life-threatening allergic reaction, Guillain-Barré syndrome, GBS, a rare neurological disorder. Seizures, more likely in young children with fever. What to watch for? Seek immediate medical help if swelling of lips, tongue, throat, trouble breathing. Severe rash or hives, persistent high fever, signs of neurological symptoms, tingling, muscle weakness. 12. Vital information. Immunity starts developing within 2 to 4 weeks of the first dose. A second dose booster provides long-term immunity, 20 years or lifelong. Safe in immunocompromised persons, but immune response may be reduced. It does not treat hepatitis A infection once already infected. Vaccination records should be documented and carried, especially for travelers. Hepatitis A vaccine may be given concurrently with other vaccines, but must be administered at separate injection sites. Have 13. Other drugs that will affect this vaccine. May reduce vaccine efficacy. Immunosuppressive therapies, corticosteroids, e.g. prednisone, chemotherapy, biologics, e.g. TNF-alpha inhibitors, immune globulin IG, if given close to vaccine, can interfere with antibody response. Live vaccines, e.g. MMR, varicella, should be spaced apart by at least 28 days if not given on the same day. General consideration, always inform your healthcare provider of all vaccines received recently, all medications, prescription, OTC, herbal. Thank you. Have a nice day.